Tonight's program, though, we do have Larry Stephenson speaking about his 2011 book, Detroit Surgeons, 300 Years. This book chronicles the surgical history of the Detroit area during the past 300 years, beginning with the surgeons who worked, or military doctors really, at Fort Ponchartrain, through the founding of the Detroit Medical College, the forerunner to Wayne State University's medical school. And then the book's main focus is the medical school's surgery department, but it also includes surgical histories of area hospitals. Dr. Larry Warren Stephenson, a former trustee of the Historical Society from 1993 to 1996, was born in Appleton, Wisconsin. He and his wife Carol have two children, Jennifer and William. And the Stephensons lived for over 16 years in the Toncourt home for which the books are named. Dr. Stephenson earned a BS degree from Marquette and then attended Marquette School of Medicine, followed by a residency at the University of Alabama, and then a cardiothoracic surgical residency at the University of Pennsylvania. He was professor of surgery at Wayne State's Medical School and a specialist in chief of cardiothoracic surgery at the Detroit Medical Center from 1989 to 2010. He was named the Ford Weber Professor of Surgery and endowed chair in 1995, and he remains an honorary staff member at Henry Ford Hospital. He also served in the U.S. Army Reserve for over 20 years, during which he received such awards as the Army Achievement Award for exceptionally meritorious service during Operation Desert Storm. Dr. Stephenson has written other books, including Heart Surgery Classics and Operation Plum, relating to an actual event that happened during World War II, and he's written many, many book chapters and articles on various subjects. I'd like to also mention that he provided us with his curriculum vitae, and it is 17 pages long, and he really needs to write his autobiography next. I'll give you Larry Stephenson. Thank you.
The book's going to be on sale afterwards, and I just want to mention that it's a 2-volume set of books, and the books are either paper or DVD, and the DVD has both volumes. But if you buy a set, the first one looks like a regular book. The volume 2's in a ring binder, and the reason we did that was because the book has a website as part of the Department of Surgery, and we intended to have people put new historical articles on there, and you could download them and put them in the second volume, which that's why it was in a spiral bound form. But we've been a little bit behind on putting a lot of articles out, but it looks like we're going to start doing that again. So that's why volume 1's bound, but volume 2's in a spiral bound book. So for the cover of this book, I picked a portion of a map, and it's the famous Colette map, which I'll mention in a minute, which is talked about in the first volume of the Toncourt books. And the guy that did this map was Patrick McNeff, and he did it and drew the map in 1796, and it actually was sort of a collage or collection of other maps that he just sort of put into one. The reason I liked it, it has the fort here, it has the river, Detroit River, it has the arrow pointing in the direction of the current, it has the ribbon farms, it has one of the Native American burial grounds here. But also this arrow is unusually large, looks very menacing, sort of implies a hostile environment, the type of environment where a surgeon's skills could be well used. Next, please. This is the entire map here. It's 4.5 by 6 feet and covers the area from the St. Clair River down to Lake Erie, and the part of the cover is this little bitty area actually it's right there. And to get to you, this map belongs to the French Army, and the Colette map is actually named after General Colette, who it's a long story, but basically had Patrick McNeff draw the map for him. And to use this map in this book and on the cover, I had to get permission from the French Army. The map resides at Chateau Vincennes in Paris. And first I went through the diplomatic corps to try to get the map. I talked to some French consul person here and then in Washington. Eventually I had to get 2 Grosse Pointe lawyers who both speak French. They donated their services. And eventually, after months, the French Army gave me permission, although they said they were going to charge me. They never did. Next. So as all of you know, the history of Detroit and the medical history starts with Cadillac arriving in 1701. Next. The fort that he built was located out where Hart Plaza is downtown, and initially there was a big bluff here that was about 50 feet high. Oh, and Jefferson Avenue would be about back here, but over time this area has been graded down, so of course the bluff isn't here anymore. But he put it on this bluff because it's a strategic area, and the fort was the initial fort was about 200 feet by 200 feet, which was pretty standard cookie cutter size fort for the French in this region when they built a new outpost. And one of the people that was an early part of the fort was the fort surgeon. And not all the forts had a surgeon. It depended on how important the fort was and sometimes or how big it was. And the first French surgeon, some people think he actually arrived with Cadillac, others think he came a little bit later, but his name was Henry Belisle. And his job was not only to take care of the troops, but also the civilians living around the fort or in the fort, and also any of the Native Americans that sought his help. And this job was the same for all the French surgeons at the fort. The British surgeons that followed had the same job description, and then when the American surgeons replaced the British, they had the same job description. And if you were at a fort where they didn't have a physician, such as Fort Michilimackinac, up where currently Mackinac City is, the French would designate somebody, either a soldier or a civilian, to take care of the sick and the wounded. Under the British, they had a warrant officer trained, and that was the same under the Americans, and the warrant officer would have been about the equivalent to a physician's assistant. But let's say you were up at Michilimackinac and you needed some medical care beyond what could be provided there. Well, what they would do is put you in a canoe and send you either to Fort Detroit or to Montreal, and it could take a month to get there. So they had to sort of figure out, first of all, if you could make the canoe ride, but that's how they did it in the olden days. The most interesting of the French surgeons was the second, or the third surgeon. That was Jean-Baptiste Chapeton, and he arrived at the fort in 1718. He was born and raised in France, had all of his medical and surgical training there, and he held the rank of major in the French army, so he actually outranked all the French captains who commanded the fort. And 2 years after he arrived, he married this young French girl. Some records indicate she was 13, others say she was 15. But over time, they had between 20 and 22 children. And in fact, some of them are members, some of his descendants are members of the Historical Society. And he stayed on as the surgeon at the fort for 35 years. And then he retired, lived in the fort and in or around the fort till he died. Next, please. The other direction. Okay. Over time, the fort kept getting bigger and bigger, and the way they did it was they just moved the walls out. So the walls just kept expanding so that it could encompass more buildings, more civilians, and more everything. And by 1760, because of some wars in eastern Canada and other events, most of Canada and most of this region was ceded to the British. So the British took the fort over, which was called Fort Ponchartrain. They took it over peacefully in 1760. And of course, they didn't want a French name for the fort, so they called it Fort Detroit. Next slide, please. The first surgeon, and I'll just clear something up here. When I say surgeon, I mean a real surgeon. And the surgeon was an army surgeon trained to operate, but he was also a physician and could take care of patients with just about any disease and pulled teeth and so forth. Probably took care of the horses too, the guys. But the reason that all the doctors in the region were surgeons, or almost all the doctors with the possible exception of Montreal and Quebec, is that they were the military surgeon at the fort, so that's why all the doctors were surgeons. But anyway, George Anton actually arrived with the British when they came from Fort Pitt where Pittsburgh is, to take over the fort. And he was a German. He was born, raised, and educated and trained as a surgeon in Germany. And it's a long story how he wound up as a surgeon in the British Army. But at any rate, as I said, his job was the same as the French surgeons. And in 1763, so 3 years after they arrived, the local Indian chief, Pontiac, who was an Ottawa Indian chief, him and his braves laid siege to the fort, and this lasted for about 3 months. There were a number of battles, a lot of people killed and wounded on each side. So during this period, Dr. Anton had to put on his hat as a level 1 trauma surgeon and operate on all these wounded people, at least people that were on the side of the soldiers, although he was more or less the doctor for the Native Americans if they sought his help. Interestingly, he decided to move out to the East Coast in 1765, and he was replaced by a British surgeon named Richard Shuckburgh. So at this point, probably everybody at the fort started singing Yankee Doodle Dandy. And the reason for that is Richard Shuckburgh wrote the song Yankee Doodle Dandy. He had written it some years earlier during the French and Indian War when he was serving as a British surgeon, and they had some American volunteer units that fought with the British against the French and their Indian allies. And wrote the song Yankee Doodle Dandy to poke fun at the Americans who they fought with because he thought they were such a bunch of hicks. Americans, on the other hand, thought the song was a compliment, so they each side made their own verses poking fun at the other side. Next slide, please. This is Lieutenant Colonel Henry Hamilton. He was not a surgeon, but during the Revolutionary War, he was the British commander for this region, and he was also the fort commander. And he used to encourage the local Native Americans to travel down to Indiana, Ohio, and Illinois and find American settlements there, attack the Americans, scalp them, and when they brought the scalps back, he paid them a bounty for the scalps. And Americans obviously were very upset about that, so they nicknamed him here, Henry the Hair Buyer. Well, at one point during the war, he decided to go down on one of these battle trips, and they were going to take one of the American forts, so he just wanted to watch them do it. And it sort of backfired, and he got captured. He got sent to Williamsburg, and Thomas Jefferson considered him a war criminal and put him in shackles for the rest of the war. After the war, he was given back to the British. They made him the military governor of Bermuda, and the town there, the capital of Bermuda, is named after him. So you might say that one of our Detroit mayors has a capital town named after him. Next. Well, when Hamilton got captured, and again, this is during the Revolutionary War, he left Captain Larnold in charge. And Larnold plus his superiors elsewhere were absolutely convinced that the Americans were going to come up from Illinois and Ohio and other areas and attack the fort in Detroit. But the fort by this time was somewhat not up to date from a standpoint of military tactics, so the British decided to build a much bigger fort about 6 blocks in from the water on higher ground and 6 blocks in from the river. And this is over where Fort Street is. And they named the fort after the captain there, Captain Richard Larnold. And this fort actually had a hospital in it, a 21-bed hospital, whereas the old French fort just had a cabin where the surgeon was, where he would treat people, and then of course if they needed hospitalization, they got hospitalized in their own bunk bed. So anyway, this was really the first hospital in the area. But what happened here was the Americans never attacked the fort, and the Revolutionary War ended, but the British, even though they were supposed to give the fort back to the Americans, as many other forts, they didn't really get around to doing it. So it took a second treaty called the Jay Treaty, and it went into effect, I believe, in 1796, where the British turned the fort over. So just like when the British took the fort over from the French, the Americans took the fort over from the British. It was a peaceful changing of the guard, and the American Army came in. General Anthony Wayne was in charge of taking all these British forts over, and he sent Lieutenant Colonel John Hamtramck ahead to actually take over the fort. And then, of course, then the doctors in the area became American surgeons, and their job description was exactly the same as the other surgeons. Next. No history on the forts in the area would be complete without talking about William Beaumont, who was an Army surgeon up at Fort Mackinac. Now, Fort Mackinac, the British closed Michilimackinac, the fort, and built a bigger fort on the island, and that was done for the same reason that they built Fort Larned, and that's because they thought the Americans were going to come up and attack, so they wanted a bigger, better fort. So that fort justified having a surgeon, so when the British gave that fort up, the Americans took it over. They had a surgeon there. At any rate, in the 1820s, shortly after Beaumont showed up, one of the French fur traders, Alexis St. Martin, was accidentally shot from about a distance of 3 feet with a shotgun. And they said that that hole in his abdomen was so big you could pass your fist through it. And Beaumont was summoned, and he debrided the wound, dressed it, and took St. Martin up to the fort so he could take care of him, but he didn't think he would survive. And St. Martin did survive, but he was left with a big hole in his abdomen that went from the skin into his stomach, and in medical terms this is called a gastrocutaneous fistula between the skin and the inside of the stomach. So over time, Beaumont kept dressing the room, the wound changing and so forth, and he got the idea, I don't know how he got this idea, but put some food on it on a string, and he started to study the digestive system. He would even take samples of the fluids and send them off for chemical analysis. He started writing medical papers that were published on the subject. He eventually wrote an entire book, and he is considered by many the father of gastric enterology or gastric physiology. And interestingly, his patient St. John or St. Martin outlived him by 30 years. Next, please. Well, fast forward a little bit. The town that grew up around Detroit was growing by leaps and bounds, and in 1845, a group of local nuns decided to open a hospital in Detroit, which turned out to be the first non-military hospital in the state of Michigan. It was called St. Vincent's. It was in an existing building, but this hospital became so overcrowded within a couple of years that they actually had to go to a bigger building. And when they did, they changed the name from St. Vincent's, which had been the name of this parochial school before they made it a hospital. They changed the name to St. Mary's. And after that, St. Mary's was the name for all the hospitals that they formed, which kept getting bigger and bigger, replacing the last one. Next, please. The second hospital, the second non-military hospital in the state of Michigan was the Marine Hospital, which has absolutely nothing to do with the Marine Corps, but it was for the mariners on the Great Lakes, and this was down at the foot of Elliott, and this building is still standing there, but you gotta sort of drive around to find it. But it started out as a 25-bed hospital, and the way this came about was on the Great Lakes, when one of the sailors would get really sick or have some contagious disease or something, they would dump them off the ship, usually in a big city like Cleveland or Detroit or Chicago or wherever. And the city fathers were sort of getting perturbed with this because it became a burden. These sick people would be laying in the alleys and so forth. They didn't have any money. So they petitioned the federal government to build these marine hospitals where they could put these sick sailors, and the sailors got 45 cents deducted from their pay once a month to support this hospital, but in return, if they got sick, they got all their free medical care there. And the doctors that staffed it were usually the local doctors that just did it on a volunteer basis. Next slide.
Can I ask,
Well,
where was that?
where was?
Marine Hospital?
Yeah, it's still in the same spot. It's right down at the foot of Mount Elliott. And if you look at that picture about 8 times and then you drive around down there, you'll be able to find it. But it's, I think the building is still used. It's down next to the Coast Guard station, but I think it's used for
Immigration.
right, exactly.
Immigration.
And so anyway, Detroit is just mushrooming. It's getting so big. And of course, for quite a while, it was the capital city of the territory and then the capital city when Michigan became a state. But by the late 1850s, the town fathers decided they needed a second hospital besides St. Mary's that would be open to the general public. So one of the businessmen in town, Walter Harper, donated a bunch of land that was elsewhere that could be sold off and used to finance the hospital project. And a friend of his, Nancy Martin, donated 5 acres of land where the hospital could be built. So they formed a group of trustees, and while they were getting ready to build this hospital, a civil war broke out, so that put everything on the back burner. And all of a sudden, the Army came to the trustees and said, "We'd like to build a hospital on your property, and in turn, after the war, we'll give you the hospital free." Well, that sounded like a pretty good deal. And at the time, the Union Army decided to build several big hospitals that were remote from the battlefields, and they would send the sick and wounded soldiers there by train. So Detroit was already receiving sick and wounded soldiers. At other places, they built an annex on St. Mary's. They were treating them at the fort and a few other places. But this hospital was built specifically for that. And since it was going to be called Harper Hospital, Army called it Harper U.S. Army General Hospital. So once the Civil War was over, the Army gave the hospital to the trustees with all the equipment, everything in it, with the stipulation that the hospital had to treat Civil War veterans free. So they had an entire ward that was just for the Civil War veterans. So in a way, it was sort of like an early VA system. Now, when the hospital opened, and this was in, I believe the year was 1866, it would be read my book, it's in there. But anyway, when it opened, you couldn't just be a doctor and show up there and decide to be on the staff. The trustees had to choose you to be on the staff. Thank you. Does this have alcohol on it?
Not yet, we can do that.
Okay. Incidentally, this talk's going to be slightly under an hour, so if you decide to leave at 50 minutes, you're going to miss 5 minutes. So anyway, the trustees had to approve or pick you to be on their staff, so this was sort of a hoity-toity type hospital. So they decided they would choose 4 surgeons, and it turns out all 4 turned out to be very prominent. Next, please. The first surgeon they picked was Theodore McGraw. I'm not saying they picked him in this order. I guess this is just the order I put the slides. But Theodore McGraw was from Detroit, and he was a Union Army surgeon. And after the hospital opened 3 years later, he was the primary person in forming the first medical school in Detroit that eventually became Wayne State School of Medicine. He was the first professor of surgery, and for many years he was the dean of the medical school. So he was one of the 4 surgeons. Next. Another surgeon was David Farron, and he was from the Detroit area, and he was a top-notch Union Army surgeon. And when Harper Army Hospital opened, he was the chief surgeon. He was very well-liked, very popular. And so when the Army closed it and it reopened a few days later, he again was one of the surgeons. Next. Another surgeon they picked was Brigadier General Charles S. Tripler, very, very prominent Union Army doctor. In the second half of the war, he was the head of the Union Army for the Great Lakes region, and his office was in Detroit. He was he was primarily responsible for picking Harper Hospital to be built in Detroit and the Union Army Hospital. And when the war ended, he still had his office in Detroit, and Union Army doctors were allowed to have private patients, so he could be on the staff at Harper. Next. And incidentally, Tripler Army Medical Center in Hawaii is named after him, one of the biggest military medical centers anywhere, and it's named for the Civil War medic who made significant contributions to military medicine. Next, please. Has anybody ever heard of Zena Pitcher?
No.
Okay, we got somebody. Well, Zena Pitchers, it turns out, was one of the most prominent citizens in Michigan, and probably the most prominent doctor of his time in Michigan. He had been an army surgeon, but before the Civil War, he's from the East Coast. He eventually was stationed in Michigan, and he decided when he retired to live in Detroit. And he was the chief surgeon and chief of staff at St. Mary's Hospital, which was very prestigious then. He was also the chief surgeon and doctor at the Marine Hospital. He helped found the medical school at U of M in 1850. And if you go to U of M now, the medical center, there's a professorship named after him. And if you drive around their big medical center, part of the roadway is Zena Pitcher Drive. He served 3 terms as the mayor of Detroit. And when the American Medical Association was founded, he was one of the first presidents. So he was the 4th doctor that was picked for the Harper staff, so pretty prestigious. Next slide, please. What happened within 20 years after the Civil war, both Harper Hospital and St. Mary's, by this time they're a little bit in competition with each other, both built big new hospitals. And since they were both part of the teaching system for the medical school, they both put in these ultra-modern amphitheaters so that the student nurses and the med students could watch the surgery and be taught. So this is the amphitheater at the new Harper Hospital. Next, this is probably about the second or third St. Mary's when it opened. Next, and this is the amphitheater there, and that's well, my laser's getting sick, but this is McGraw here, who's the professor of surgery. Next slide, please. As the city grew, what did they do with the indigent people? Some of them really didn't require acute hospitalization. Some of them were just chronically sick and they slept in the alleys. They did this and the other thing. They couldn't keep them in the hospital all the time. So the city fathers negotiated with the army surgeons at Fort. And let me just tell you something, these forts frequently changed names. So Fort Larned, when the Americans took it over, it was just like when the British took over the French fort, they changed it to Fort Detroit. But when the Americans took over Fort Larned, they didn't want it named after British soldiers, so they named it Fort Detroit. Now, later, after the War of 1812, it became Fort Shelby, so they're different names for the same forts, but at any rate, the city fathers negotiated with doctors at Fort Shelby, and they had a hospital there, and they worked out a deal that the indigents that needed chronic care or acute hospitalization were treated there. And in turn, the city had to pay the army 25 cents a day for whatever care they got. But by 1915, the fort had been torn down for a long time by then. The city built this big hospital called Receiving Hospital. It was not only for the city's indigents, but it was a big trauma hospital, and it was staffed by the medical school. Next slide. Fast forwarding to World War I, before we got involved in the war of course started in 1914. We started to prepare a lot of the doctors and nurses, joined reserve units. The Red Cross formed these hospital units at these big major city hospitals that in time of war would convert to military hospitals. And the first unit to go over was from Case Western Reserve, and they went over right after war was declared. But when we got involved in the war in 1817, this guy here, George Crow, was a very prominent surgeon nationally, and he led that unit. Shane, the reason I mentioned him in the book is he was a Detroit surgeon who trained under Crow, and he would become he got talked into going with the Cleveland unit because he had trained there, but he ultimately would become a very prominent surgeon in Detroit. But to stick with the Detroit story, next slide please. Detroit fielded two absolutely huge hospitals for World War I. One was Base Hospital 17, which was the doctors and nurses from Harper, and the other was Base Hospital 36, which was formed around the medical school faculty, and the nurses were recruited elsewhere. But they both got shipped over to France. They were near the front lines. They used mainly existing buildings and then added 10 cities. And of course they were close enough that they were getting battle injuries directly off the battlefield, or maybe 20 miles from the front lines. And Base Hospital 17 grew to a 2,000 bed hospital, which is gigantic. And Base Hospital 36 grew to a 3,000 bed hospital, so they were two of the largest American military hospitals in France during the war. This picture here, this is Angus McLean on the left and Bert Shirley on the right. McLean commanded Base Hospital 17 and Shirley Base Hospital 36. They're over in France, winter of 1917-18, and they're conferring. But McLean was chief of surgery at Harper and the professor in chief surgery at the med school. Bert Shirley was chief of ENT at the med school and also dean of the med school. And of course, once the war was over, everybody came back to work in Detroit. Next, please. Next.
Sorry, please.
Anybody ever hear of Norman Bethune? There's a Bethune Street, but it's no relation. Norman Bethune is pretty famous. There's at least a dozen books written about him, many documentaries, and about 15 years ago there was a movie called Dr. Bethune where Donald Sutherland played the part of Dr. Bethune. But at any rate, he was a Canadian who did his medical school in Toronto, went over, did his surgical training in England, and then decided to start his career as a doctor in Detroit. So him and his Scottish-born wife moved to Detroit. This was 1924, and this was and he was on the staff at Harper, and he was a faculty member at the med school and very popular with the students. This was a time when there was this huge tuberculosis epidemic in this country, especially in the bigger cities where everybody was close together. And Detroit was hit particularly bad during this period. And 2 years after Bethune was here, he contracted tuberculosis and wound up at Lake Saranac, New York, in the TB sanitarium. About a year later, he was recovered enough that he came back and started his practice again, but then had a relapse, went back to Saranac. And then when he got out, he decided he was going to subspecialize in chest surgery, which of course is what I specialized in. And so he went to McGill in Montreal, trained as a chest surgeon, and then stayed on the faculty there. But he did come back to Detroit a number of times. One time, the chief chest surgeon at Herman Kiefer Hospital and at the Northville Hospital was in an auto accident, so they sent for Bethune, and he came back and was the acting chief at the two hospitals for several months till the guy recovered. After he returned to Montreal, he decided to be a volunteer surgeon for the Spanish Civil War. Went over there and he created all kinds of these innovative methods, blood transfusions. At this point, there really were no blood banks in this country or any place, and he did a lot over there, but when he returned, just after he returned, the Japanese invaded China. So Bethune decides he's going to go over to China as a surgeon and help out the Chinese army. So he does this big trip in Canada and the U.S. to raise money for supplies to have a hospital, a mobile army hospital, and then he took it over to China, and he called the hospital a Canadian-American hospital because he got funds from the Canadians and Americans. Within a few months after he got to China, he met up with Mao and his Red Army. They were one of two factions fighting against the Japanese, and within a short period, he was ahead of Mao's Red Army Medical Corps with 20 hospitals reporting to him. And he did a lot of the surgery himself, and in the latter part of 1939, he was operating on a Chinese soldier with an infected wound. He cut his finger, and within a week he was dead of septic shock. Of course, this was the days before antibiotics. But as a result of this, his fame has continued to grow. There are statues of him in China and in Canada. Both countries have released postage stamps with this picture. There's a medical school in China named after him. In Canada, the house he was born in is managed by their national park system. So anyway, this is another one of our local surgeons. Next, please. I think most of you have heard of Harry Houdini. He's probably one of the most famous magicians ever. Next, please. He was raised in Appleton, Wisconsin, same town I came from. Some people say his best escape act was leaving Appleton. But he died here in Detroit, and prior to his death for many years, he would show up in Detroit and put on these shows, and there's a lot of famous stories about him in Detroit. But in 1926, he was performing in Montreal for about a week, and then he took a train from Montreal to Detroit with his entourage, and he had a Sunday afternoon performance. And after the performance, he just fell down on the stage, and he had a temperature of 104, and he was complaining of abdominal pain. And the people there encouraged him to go to the hospital, but he refused, and he took a taxi with his wife and some of his other people back to the hotel, and the hotel physician examined him, and next please. And he sent for Charles Kennedy, who was one of the very prominent surgeons in Detroit. He was on the staff at a number of hospitals, but he was chief of surgery at Grace. And Kennedy decided that he needed an emergent abdominal operation. Houdini refused, and later that evening he called his physician in New York, talked it over with him. His physician encouraged him to go to the hospital. So after he got there, Grace Hospital, Kennedy operated on him, and his abdomen was tense. And when he opened his abdomen, the contents were under such pressure that the pus just squirted out all over the drapes and on the floor and so forth. And he had a ruptured appendix, but even worse than that, the appendix was dead or necrotic, it was all black and so forth. Well, Kennedy cleaned things up, sewed them up, and Houdini made a miraculous recovery over the next several days. And his recovery was followed in the Detroit newspapers as well as the national, international newspapers. But that Friday, he's operated on Monday. Friday, his condition took a big nosedive. And again, this was before antibiotics. And Kennedy decided that he probably had a loculated abscess in his abdomen. So he took him back to surgery to drain the abscess, but Houdini made it through the surgery, but he never really recovered, and he died at Grace on Sunday afternoon.
Halloween.
Halloween.
Right. And I know a number of the people that have been in the room that he died on Halloween. My office is about 100 yards from that room, but the hospital's been torn down. Next, please. So I know that everybody in this room was wondering what happened to the sailors at the Marine Hospital. Well, there are so many of them over time that they had to build this big new hospital down on Bicknell Point. Here you can see the lighthouse. This was just over the border near Alta Road. And this hospital opened in 1930. And initially it was 175 beds, but it kept growing. And this was the Marine Hospital, but for various reasons, other hospitals took its place with different healthcare systems. And so this closed, and once it got torn down, it's where the famous trailer park was. But the trailer parks recently disappeared, so who knows what's going to be there next. Next slide, please. Fast forward to World War II. This picture was taken in May 1941, and it's a group of the faculty surgeons. You know, all know what happened December 7th, 1941. So by May 1942, all of the doctors in this picture were they were all gone, and they were either surgeons in the Army or the Navy. So how did we get care in town? Well, what happened, the older doctors who had served in World War I were left behind to take over. And Kennedy, for example, who had served in World War I, when they were all gone, was not only the chief at Grace, but he also became the chief at Detroit Receiving and other hospitals to take over, just because he was sort of a chief type guy. Next. This picture is taken shortly after the war. This thing's getting anemic, but this is 3 doctors here. We don't know who the lady is, but these 3 doctors all served in World War II. Dr. Penberthy also served in World War I, but for many years he was the chief of surgery at Children's Hospital. Very famous guy. This is Dr. Johnston, who was the professor-in-chief at the med school and chief at the receiving chief at the VA hospital and so forth. And he was in the Navy during the war, and then Crowley had just finished his surgical training before the war, and when he got back he joined the faculty. Next slide, please. In the early 60s, Crowley wrote this novel based on his experiences as an intern at Detroit Receiving, and any old timer that reads it can tell although the names were changed, they can tell who everybody is. And Dr. Johnston is the main character. I read the book and enjoyed it, but it was basically a mini bestseller back in the 60s. Next slide, please. This photograph was taken in Detroit in about 1955 at a black fraternity house, and these 3 guys were just there impromptu. And I got this photograph from the wife of one of them, who's 103, and she gave me the details. But it was this impromptu meeting. Thurgood Marshall at the time was the head legal counsel for the NAACP. Remus Robinson was the first board-certified black surgeon in Detroit. At the time, he was also president of the Detroit School Board, and Wade McCreed was a young local judge. If you fast forward a couple of years, Thurgood Marshall is a Supreme Court Justice. Remus Robinson, still a surgeon with a big practice. He's still president of the Detroit School Board. But Wayne State University has just become Wayne State. It used to be Wayne University, which is the city college, became Wayne State, the state college. And Robinson becomes the first chairman of the Board of Trustees in addition to his other two hats. And of course, Wade McCreed becomes a very prominent federal judge. So, interesting picture. Next slide. This is Jerry Rosenberg, one of the medical faculty. In 1968, he performed the first successful kidney transplant in the state, which is at Detroit Receiving. Next, please. When I ask people, where did the first successful open heart operation in the world, where did it take place? People will always tell you, they'll either say the Mayo Clinic, the Cleveland Clinic, Johns Hopkins in Baltimore, where it took place in Cape Town, South Africa. The correct answer is Detroit at Harper Hospital. And surgery took place in 1952, and Dr. Dodrell up there, who's medical school faculty, did the surgery, and General Motors built the pump here, right there. And these two guys running the pump are General Motors employees. This guy here is the second in command at the General Motors Research Laboratory, so he's really a big honcho at General Motors. His name is Ed Rippengale, and this is Calvin Hughes, who later on, at the time, he was an employee at General Motors, sort of a lab tech, but he would become a prominent psychiatrist in the area. Next, please. And of course, you all know about the 1968 Detroit riot, which was one of the worst ever in the United States, and certainly the worst in Detroit's history. And it lasted about 6 days. The National Guard got called in, the federal troops. My brother from the 82nd Airborne was one of them. But anyway, there were over 1,000 people injured and 47 people killed, and most of those people were treated at Detroit Receiving, over 750 of them. 30 of those that were killed either died in ambulances on the way to Receiving or died right after they arrived there. But anyway, here's a bunch of the surgeons there and surgical residents pouncing on a victim. Here you can see his arms, chest, arms sticking out. Next slide, please. Here are a number of the residents, surgeons, one nurse waiting for the next ambulance to arrive. Next slide. This is Anna Ledgerwood, who lives here in Grosse Pointe. She's lived here for many years. She started her intern. She came from out of town. She started her internship at Receiving about 3 days before the riot started. At the time, the interns lived at the hospital. Each had a room that was 6 feet by 6 feet, and she spent about her first 10 days there 24/7 with the riots. As a result of that, she got her baptism of fire and trauma. She's become a very prominent national surgeon, president of all kinds of societies, including the American Society of Trauma, probably, or trauma surgery, probably some of it related to her experience the first week that she moved to Detroit. Next slide, please. Anybody ever hear of Adrian Kantrowitz? For many years, he was the chief of surgery at Sinai Hospital, chief of surgery and cardiothoracic, and he was also a professor at the med school. He did all kinds of famous things. He did the second heart transplant in the world a couple of days after Barnard did the first. He invented some of the earliest pacemakers, but the thing he's most famous for is he developed what's called an intra-aortic balloon pump. And when somebody's heart is acutely failing from a heart attack or some other reason, and they used all the medicines to try to keep them going and everything else fails, they stick a big needle into an artery, usually in the groin, but it can be elsewhere, and they thread this balloon in, and it's connected to a console with a pump, and it pumps in synchrony with the heart, and it helps the heart pump blood, and it's a temporary thing, and it can be, he invented this in the 60s, and they first put it in patients in the 60s. But, so it's been around a long time, but it may only be needed for a couple hours or a couple days or sometimes a couple of weeks. But it's estimated that over 200,000 of these are put in every year around the world, and at least 100,000 patients leave the hospital because of this. So this is a pretty big contribution. Okay, next. There are a number of prominent black surgeons featured in the book, and I'll just mention two. This is Charles Wright, prominent OB/GYN surgeon. Charles Wright, African-American Museum's named after him. He's written a number of books about advocating care for patients and civil rights type rights for patients. And when Martin Luther King used to do his marches down south, Wright would get on a plane or drive and go down there and set up for first aid stations to treat the injured or sick marchers. And he also felt that that the African Americans should take more pride in their history. So he opened this little museum in his basement of his house, and then later he bought an old house trailer and put all kinds of historical stuff in it, and would drive around the state or pay others to do it out of his own pocket and go around and explain to African Americans or anybody else about African American history. So that's why when they built this big museum here, they named it after him, and if you haven't been down there, you ought to go down there. It's well worth the trip, and it's pretty spectacular. Next slide. This is Walter Evans. Him and his wife lived in Grosse Pointe until he retired about 6, 7, 8 years ago when they moved to Savannah, where he's from. Went to medical school at the University of Michigan, had one of the biggest surgical practices in the state. What's interesting about him is he got into collecting African American art and African American literature and wound up with like the biggest collection, one of the biggest collections anywhere. He's had his art, some of his art has been on shows in almost every major museum in this country, and many, including the Louvre in France. And when he moved to Savannah, the big museum there, the part of the school of the
Designs.
yes, Savannah's College of Design and Art, or Art and Design. They have a big art museum, and one of the wings houses a small part of his collection, entire wing. So if somebody goes down there, I sometimes give him a call, and he gives them a personal tour. But his African-American collection of books, manuscripts, and other things. He has over 100,000, and recently the National Library of Medicine invited him to pick his favorite 10 pieces, and they did a 70-minute television show on him talking at the National Library, and that, of course, you can go to YouTube to see. But anyway, that's one of our fellow Grosse Pointers. Next slide, please. I'm almost done. This is Dr. Walt when he retired as chairman downtown after several years, and this is Don Weaver, who was young then. For the last 10 years he's been the chairman. But Walt's an interesting guy, and he was also, besides being the chairman of the department, he was the president of the American College of Surgeons, which is the biggest surgical group in North America, 80,000 surgeons of all specialties from in the US and Canada. So I just want to mention a quick thing. Next slide, please. He was from South Africa. And of course, South Africa during World War II was a Commonwealth country of the British, so they were fought with the Allies. And he dropped out of med school, and so did his friend Hoffenberg. And they became medics, and they were an invasion of Sicily and all kinds of things, but they pulled so many practical jokes and mischief, they had to separate the two of them. They went back to med school. Walt trained as a surgeon, Hoffenberg as an internist. Walt eventually left with his family, came here and did the things I just told you about. Hoffenberg, as an internist, got involved in the anti-apartheid, anti-government programs in South Africa, and he was such a nuisance, they kicked him out of the country and told him he could never come back. He went to England, became a professor of internal medicine, president of the Royal College of Medicine, of Royal College of Physicians, was knighted, and then later in life was made president of one of the colleges at Oxford. So when Walt retired, Hoffenberg talked him into coming over and doing a year sabbatical, which was very productive. Walt studied breast cancer, the way different governments handled it in Europe, came back and started a big breast cancer clinic that, when he died, was called Walt Breast Cancer Clinic at Carmanis. But anyway, interesting story. Next, please. So this book not only covers the main theme of the surgeons, it also covers the surgical histories of the different hospitals downtown and the different specialties that eventually emerged out of general surgery. But I also picked 4 of the bigger hospitals in town, and I asked the chief of surgery at each hospital to write the surgical history, which is in the book. Next. And you might say, well, why didn't you include more than 4 of the hospitals? Well, if you look at this, by 1967, there were over 120 hospitals either functioning or that had existed in the Detroit area. So if I included all of them, I not only would have carpal tunnel syndrome, but I'd still be writing the book. Next slide, please. So just to mention a few local things, Bon Secours on Grosse Pointe was established by the Bon Secours sisters, opened in 1945. Cottage, which I guess grew out of the neighborhood club. They were housing or treating patients with the big influenza epidemic, and they opened their hospital in 1928. And then St. John, which is across the street from Grosse Pointe opened in '52 next. And I think many of you know Larry Lloyd, but he was the chief of surgery there for 19 years. He's the guy that wrote the part in my book about St. John. Next slide, please. One of their early doctors there, who was a professor at the med school, was C. Jackson France. Some of you may have known him. And he helped establish the surgery program there and the training program, and also served as as early chief of staff there. Last slide. And so to summarize, if you look back 300 years, all we had was a one-room cabin where the Fort surgeon took care of people with malaria, rabies, or drained an abscess, pulled teeth, and just think what we have now. Of course, we have a bigger population, but we have thousands of doctors, hundreds and hundreds of surgeons of all specialties, and that's about it. So thanks for your attention.
Larry's going to sign books. Are there any questions?
Well, I know that all the questions you have are going to be about my talk next month on the Grosse Pointe Yacht Club. So we have a Commodore here, Ron Shaw, here to answer your questions. But any questions? Any questions on this talk?
Just one, these early surgeons, do you know anything about their training? I mean, did they have much? Was it standardized?
A lot of that's covered in the book. And also there's a lot of stuff covered about all the different things they did, the cholera epidemics in Detroit and all the other stuff that went on in those days. And as far as the training goes, you'll fall asleep. There's so much in there about it. Any other questions?
Is Donald Weaver that you showed the picture of, is he the son of Arthur Weaver?
Yep.
Okay.
And there's pictures of Arthur in the book too.
Arthur's quite a...
Yeah, he is. Yeah. And incidentally, if you go to an osteopath doctor, there's a big history of osteopathic surgery in Detroit, all their hospitals and all that stuff. And the only one making a profit off this book, if you do buy one, is the Grosse Pointe Historical Society, because the surgery department is selling the books at their cost. And I don't make any profit, so the only one making any money is going to be busy.